Alright, so buckle up, because this is going to take a minute to explain, but it's important. There are a variety of drugs that can be used to treat opioid use disorders, but they're all variations of the same three ingredients. Those ingredients are naloxone, methadone, and buprenorphine. If you follow me, you know I'm usually talking about methadone, but today we're going to talk about all three. Before we do that, we're going to have to back up a little bit and do a little bit of basic neuroscience. So bear with me on that. Your brain is full of cells, and on those cells you have receptors. Those receptors are like a lock. They only open to certain keys. Some of your cells have opioid-specific receptors. That means that opioids can bind to those receptors and open them. Now, all three of these drugs, methadone, buprenorphine, and naloxone, bind to the same types of receptors, opioid receptors. But they don't all act the same way when they bind to these receptors. So naloxone, for example, which is the main ingredient in Vivitrol, sticks to these receptors, but it doesn't actually open them. It just blocks them. That means that if you did take an opioid after you took something like Vivitrol, it would be really hard to get high because most of the receptors would be blocked by Vivitrol. That can be good for people who just need a little deterrent to using drugs, but for those of us who might have withdrawal symptoms or cravings, it's really not going to do a whole lot. Now, when it comes to buprenorphine and methadone, those do both activate these receptors, but they do so to different degrees. Methadone is what's considered a full agonist. That means that when it binds to these receptors, it can activate them to the maximum potential. If you take more methadone, you get more of an effect, which is why it's possible to get high and even overdose on methadone in some situations. Still, it's much less likely to happen with methadone than it would be with something like fentanyl or heroin or OxyContin. We'll talk about that another time. Now, buprenorphine, on the other hand, which is the main ingredient in drugs like Suboxone, is what's called a partial agonist. It does activate those opioid receptors, but it doesn't do so to the maximum extent. For that reason, there's a limit to the drug's effects. It can still make some people feel safer, and that's one reason they might like buprenorphine over methadone. It's also more available. People can get prescribed by their doctor's offices and pick it up at the pharmacy. There's also some evidence of racial discrimination on who gets offered which drug, but that's also a story for another time. Still, in the age of fentanyl, when people who have opioid use disorders tend to have really high tolerances, it seems like methadone may be more effective for a lot of people. And so people with higher tolerances may feel more stable with a drug like methadone, a full agonist that can activate those receptors to a higher extent than buprenorphine can. If you want to know more about opioid use disorders and medication-assisted treatment, be sure to give me a follow and maybe smash some of those other buttons too.